Hi friends, welcome to Medbits, your exam savior. Today, let's discuss about juxtaglomerular apparatus, part 2 from Physiology. This includes short-term and long-term pressure regulation. As JGA is a very important question for the university exams, this is divided into 3 parts. All the 3 questions are equally important. What is JGA? That's being covered in part 1, and this video covers short-term and long-term blood pressure regulation, RAAS, and the third part is about counter current mechanism. Those who haven't learned part 1, please do that also. Having a diagram for the university exam is very important for getting better marks. And blood pressure regulation method, that diagram is very easy and cute one. From the diagram you can understand the involvement of different organs of a body when the pressure is being changed. See how much kidney is involved and what enzyme is produced, and then what's the work of our liver, and then what happens there, and what's the work of lungs and ACE inhibitors, and what is done by adrenal gland, and this all together how the BP is changed. These all factors are well explained. If you are interested, you can learn this diagram, or next slide also comes another very easy diagram. This blood pressure regulation is known as RAAS. Let's look into the different steps involved in it. Okay, see this diagram, it's very easy to understand. Okay, we are now starting with the part of kidney. And what happens there? That's the step number 1. Renin release. The first stage of the RAAS is the release of the enzyme renin. Renin is an enzyme. See, renin is released. Renin is released from granular cells of the renal juxtaglomerular apparatus in response to one of the 3 factors. There are 3 reasons if renin has to be released from the JGA. What are the 3 reasons? Number 1 is reduced sodium delivery to the distal convoluted tubule detected by macula densa cells. That is number 1 reason. The sodium delivery is reduced from convoluted tubule. And the second is reduced perfusion pressure in the kidney detected by the baroreceptors in the efferent arteriole. And the third reason is sympathetic stimulation of the JGA via beta-1 adrenoreceptors. These 3 reasons, any of the 3 reasons can contribute for a renin release from the JGA. Step number 2 is angiotensin 1 production. From where it comes? Let's look into that. See, in liver, angiotensinogen, which is a precursor protein, that is converted to angiotensin 1 with the presence of renin. See, with the presence of renin, liver is producing angiotensin 1. And what is the third stage? That is angiotensin 2 production. From where it comes? Let's look into the diagram again. See, in lungs, angiotensin 2 is formed from angiotensin 1 with the support of angiotensin converting enzyme, which is known as ACE inhibitors. See, now we got angiotensin 2. Now let's look into the effects of angiotensin 2. The first effect is on cardiovascular side. Angiotensin 2 acts on AT1 receptors found in the endothelium of arterioles throughout the circulation to achieve vasoconstriction. The net effect is an increase in total peripheral resistance, and consequently blood pressure also increases. The effect of angiotensin 2 on the neural side is angiotensin 2 act at the hypothalamus to stimulate the sensation of thirst, resulting in an increase in fluid consumption. This helps to raise the circulating volume, and in turn, what also gets raised? The blood pressure. It also increases the secretion of antidiuretic hormone ADH from the posterior pituitary gland, resulting in the production of more concentrated urine to reduce the loss of fluid from urination. This allows the circulating volume to be better maintained until more fluids can be consumed. This is the third effect of angiotensin 1. The first was on cardiovascular and second was on neural, and the third is on the renal side. Angiotensin 2 act on the kidneys to produce afferent and efferent arteriole constriction and increased sodium reabsorption in the proximal convoluted tubule. This is the pressure regulation in short-term method. Until now we answered blood pressure regulation short-term method. Now we are going to blood pressure regulation long-term method. Until we learn now also to be written and then the remaining part. It's very easy. See what we learn now. A very small recap let's make. Whenever there is a pressure variation, Jga is producing an enzyme known as renin, and then the presence of renin makes liver convert angiotensinogen to angiotensin, and from the lungs ACE inhibitors are producing angiotensin 2, which helps for the vasoconstriction and the blood pressure also getting increased. We learn about it, and that is the short term. And now we are talking about the long term, the next steps also. See, finally angiotensin 2 act on the adrenal cortex. Where it is situated, you can see it's on top of kidney, and then stimulate the release of aldosterone, you can see here, which is a steroid hormone. Aldosterone acts on the principal cells of collecting tubule ducts in the nephron. It initiates epithelial Na+ channels to reabsorb urinary sodium. Furthermore, the activity of the basolateral Na+, K+ ATPase is also increased. We are again talking about the aldosterone production itself. See, aldosterone production causes the additional sodium reabsorbed through ENAC to be pumped into the blood by the sodium-potassium pump. In exchange, potassium is moved from the blood into the principal cell of nephron. This potassium then exits the cell into the renal tubule to be excreted into the urine. As a result, increased level of aldosterone cause reduced level of potassium in the blood. Let's look into a simple topic, very short, that's about renal diseases which happens due to the pressure variations. The two most important prognostic factors in chronic kidney disease are hypertension and proteinuria. ACE inhibitors are therefore important in the management of diabetic nephropathy and other forms of chronic renal impairment. This is because they both reduce systemic blood pressure and reduce urinary protein excretion. See, you can see here about the hypertension diagram. Here you can see if there is no hypertension, how easily blood is flowing through the vessels. And if there is a hypertension, see how tough it is for the blood to pass through the vessels. And this is about proteinuria. Proteinuria, what are the symptoms there? The pain during urination, and urine will be foamy, and shortness of breath, swollen face, fatigue and backache. The mechanism by which the reduced proteinuria is likely related to the inhibition of the vasoconstriction that occurs in the efferent arteriole in the glomerulus, thus reducing GFR and reducing urinary protein excretion. It is important to note that ACE inhibitors must be used in caution in patients with bilateral renal artery stenosis and should often be withheld in instances of acute kidney injury, as the reduction in GFR can be harmful. We have learned about the factors affecting GFR rate in the video which we learn about GFR. Regulation of glomerular flow and GFR. Macula densa of JGA plays important role in feedback mechanism called tubuloglomerular feedback mechanism. This mechanism regulates the renal blood flow and GFR. Let's look into the definition of tubuloglomerular feedback mechanism. This feedback mechanism is a mechanism that regulates GFR through renal tubule and macula densa. Macula densa detects the sodium chloride concentration via Na+, K+, 2Cl- cotransporter. Adenosine acts on afferent arteriole via adenosine A1 receptors. Congratulations friends, we have completed part 2 of JGA. Here we have learned very thoroughly how the regulation of blood pressure in the short-term and long-term method is done. You can just have a recap on it, and all the best. Let's see on the next video, that's about counter current mechanism. If you feel this video is useful for you, please do like, and you can share with your friends also. Thank you so much.